Welcome to the RepuGen podcast, where we transform patient care.
Welcome back to another episode of the RepuGen podcast. I'm Jennifer.
And I'm John.
Today, we're covering RepuGen's study on how patients choose healthcare providers in 2026 game.
Yeah, and to do that, we're going to really embark on a complete deep dive into this data to figure out, what actually makes you click that book appointment button in today's digital landscape.
Right, because it's completely changed. And to start us off, I kind of want you to imagine a scenario.
Okay, let's hear it.
So you need to find a new specialist, right? Maybe a cardiologist or a surgeon. You pull up your search engine and you narrow it down to two options.
Okay, pretty standard.
Right. So Dr. A has a near-perfect 4.9 star rating. Dr. B has a visibly lower 4.5 star rating. Which one do you actually call?
I mean, intuitively, you'd think the 4.9 is the obvious winner.
Exactly. But in this massive new behavioral study we're looking at today, over half of the patients actively chose the doctor with the worst score.
Which is just wild to think about.
It really is. So today, we're going to dissect the hidden psychology behind that choice and explore which review metrics and reputation signals actually influence your healthcare decisions the most.
And that paradox, choosing the lower score, is really at the very heart of what we are unpacking today. Because choosing a healthcare provider isn't like buying a pair of shoes. It's an exercise in managing intense personal vulnerability.
Yeah, the stakes are so much higher.
Exactly. We aren't just analyzing vanity metrics for medical clinics here. We are looking at how you, as a human being, attempt to reduce uncertainty when your health and often your dignity is on the line.
Right, which makes this data so crucial. But before we can really decipher the psychology of those decisions, we should probably establish the baseline of how this behavioral data was captured.
Yeah, let's briefly go over that.
So we are pulling these insights from a highly targeted quantitative survey. It was a blind, anonymous SurveyMonkey questionnaire, gathering responses from 647 individuals across the United States.
And that specific cross-section is actually important to highlight just briefly. It spanned all household income brackets and included both men and women.
Right, a good mix.
Yeah, and crucially, roughly 80% of the respondents fell into the 18 to 64 age range. So it's really capturing the primary active patient population, with the remainder being 65 and older.
And that snapshot of the active patient population delivered an absolutely staggering anchor finding right out of the gate.
It really did.
Roughly 89% of patients check online reviews when researching a new healthcare provider. I mean, almost 9 out of 10.
It's basically everyone at this point.
Okay, let's unpack this for a second, though. I have to push back on that number. The volume is huge, yes. But are we actually assuming that you're shopping for a pediatrician or an oncologist the exact same way you shop for a trendy new taco stand on Yelp?
Well, the stakes are obviously different.
Right. The emotional stakes are entirely different.
If we connect this to the bigger picture, though, the fundamental mechanism of trust is actually identical. This behavior stems entirely from perceived risk.
How so?
Well, decades ago, if you needed a specialist, your family doctor handed you a physical card, or maybe your neighbor gave you a glowing personal recommendation, right?
Yeah, word of mouth.
Exactly. You had absolute trust transferred from a known entity. But today, maybe your insurance network changed, or you relocated to a new state. When you lack a personal referral, you are staring into a massive information vacuum.
Oh, that makes sense. So you just have nothing to go on.
Right. And online reviews have stepped in to act as vital social proof. They're essentially the only mechanism available to bridge that terrifying trust gap.
Wow. So we are essentially outsourcing our medical trust to the collective experiences of total strangers.
Yep, that's exactly what's happening.
Which creates a fascinating ripple effect. Because if 89% of the population relies on this outsourced trust, it means a clinic's digital reputation isn't just like a marketing add-on anymore.
No, not at all.
It is the primary lens through which their medical competence is judged, well before you ever set foot in the waiting room.
Which leads us directly back to that paradox you introduced at the start of our deep dive.
Right, the whole 4.9 versus 4.5 thing.
Yeah. If everyone is looking at these metrics so closely, why are they actively rejecting perfection?
Let's weigh out the exact numbers from the study scenario so we have the full picture. When presented with two options, 56.8% of patients explicitly stated they would choose a provider with a 4.5 star rating and 1,050 reviews.
Over the other guy.
Right. Over a provider with a 4.9 star rating who only had 25 reviews. People actively downgraded their requirement for a perfect score just to get access to a higher volume of feedback.
And the study specifically attributes this behavior to a concept called Bayesian trust.
Bayesian trust. What does that mean in this context?
Well, even if you've never taken an advanced statistics class, your brain just intuitively understands how data distribution works. We inherently sense that larger data sets are statistically stable and, frankly, closer to the objective truth.
Okay, that makes sense.
So if you see a doctor with a pristine 4.9 rating, but only 25 reviews, your subconscious immediately flags it as fragile.
Yeah, it feels, I don't know, it feels easily manipulated.
Exactly. It could just be the doctor's immediate family and a few lucky patients padding the score.
Or like a coordinated internal effort by the clinic staff to look good. It's kind of like walking down the street in an unfamiliar city looking for coffee. You see a cafe that is totally pristine, gleaming, claims to have 5-star coffee, but it is completely empty.
Always a red flag.
Right. And then across the street, there's a cafe with slightly scuffed floors and maybe a smudge on the window, but there is a line of 40 people wrapped around the building. You are going to get in that line.
Because the sheer volume of the crowd signals authenticity.
Exactly. It makes you completely forgive the scuffed floor.
That is the perfect visualization of Bayesian trust in action. The crowd neutralizes the skepticism. And in the medical field, patients are desperately looking for that crowd because volume provides this impenetrable shield of credibility.
Let me test that logic, though. I understand the coffee shop, and I totally understand picking a general practitioner that way. But if I am looking for a neurosurgeon to operate on my spine...
Higher stakes.
Yeah, I am going to be deeply uncomfortable with the scuffed floor in that scenario. I want perfection. Does this preference for volume over a high score really hold up across high-stakes specialties?
The study suggests it actually applies broadly, yeah. Because the fear of manipulation often outweighs the desire for perceived perfection, even then.
Really? Even for a surgeon?
Yeah, think about it. A 4.9 with 25 reviews for a neurosurgeon might actually cause more anxiety. You might wonder, well, what happened to the hundreds of other patients who didn't leave a review? Were their outcomes bad?
Oh, wow. I hadn't thought of that.
Whereas a 4.5 with 1,000 reviews tells you this surgeon operates frequently and the vast majority of people survive and are satisfied. The stability of that high volume acts as a massive anxiety reducer.
Okay, a massive crowd definitely gives you authenticity, but I mean, a crowd from 5 years ago doesn't prove the coffee is good today. Authenticity expires, right?
Oh, absolutely.
Which introduces a totally different problem for healthcare providers, the freshness of the data.
Yes, the expiration date on trust is incredibly short. The survey data revealed that roughly 66% of patients consider both the average rating and the recency of the reviews simultaneously.
So a pristine reputation built in, say, 2021 is essentially a relic to a patient searching in 2026.
Pretty much useless.
Because the reality of healthcare operations is constantly shifting. Like, the brilliant nurse practitioner might have moved to another state, or the independent clinic might have been absorbed by a massive corporate network.
Which completely changes the billing practices and wait times.
Exactly. And patients know this. You want to know what the care is like this morning, not 3 years ago.
But the good news for providers is that the raw material for this fresh data is constantly walking out their front doors.
What do you mean?
Well, the survey found that a staggering 80% of respondents had actually visited a healthcare provider in just the past 3 months.
80%? That's huge.
Right. We often think of doctor visits as rare episodic events, but across the broader population, they are incredibly frequent. There is a massive perishable pool of fresh experiences generated every single day.
So if a practice isn't capturing that sentiment while it's fresh, they are basically letting their most valuable reputation asset evaporate.
Exactly.
And that perishable pool of experiences ties into another nuance about what a good rating actually is. We established that 4.9 can seem suspicious if the volume is low, but the study goes further, right?
Yeah, it indicates that patients actually prefer providers who sit in the 4.0 to 4.5 range overall.
So the slight imperfection isn't just tolerated, it's practically demanded.
It acts as the ultimate proof of reality. A 4.2 or 4.5 rating signals high clinical quality, but it also signals a human organization.
It tells you that the clinic doesn't censor its feedback.
Right. It significantly reduces initial skepticism because you're seeing a balanced, realistic portrayal of the practice.
This is where the data slices into human behavior in a really compelling way, too, because men and women do not process that realistic 4.2 star rating the same way at all.
No, the study highlighted a stark divide in how genders navigate these metrics.
The divide is fascinating. Men, generally speaking, lean heavily into the quantitative data.
Right, they look at the average star rating, check the total number of reviews to satisfy that Bayesian trust requirement, do the quick mental math, and just make a rapid decision.
But women, on the other hand, place a substantially heavier emphasis on the qualitative data, the actual written narratives behind those stars.
Yes, the stories.
And I can immediately see why that happens. A star rating is just a mathematical aggregate of outcomes. It doesn't tell me if I'm going to feel humiliated in a paper gown, you know?
Exactly.
What specific depth of information are these written stories providing to female patients that the bold numbers simply can't capture?
The narratives basically serve as a detailed roadmap of the patient journey. When women parse through these written reviews, they are often hunting for the interpersonal context of the care.
The bedside manner stuff.
Yeah, they want to know about the doctor's bedside manner and whether they actively listened or just rushed through a checklist. But they're also evaluating the entire ecosystem of the clinic.
Right, like, was the billing department transparent or combative?
Were the waiting rooms clean? How did the
Yeah.
front desk staff treat people who were clearly in distress?
So they are really vetting the emotional safety of the environment, not just the clinical competence of the physician.
Yes, you could have a brilliant surgeon who deserves a 5.0 for the procedure itself, but if the narrative reveals that the office manager is chronically dismissive, a patient might entirely bypass that clinic.
The written narratives empower a much more holistic, informed decision. It really necessitates a dual language approach for any medical practice.
What do you mean by dual language?
Like, if you are designing a website or a provider profile, you cannot just cater to one demographic. You must prominently display the bold quantitative metrics and review counts for the analytical searchers,
I see.
while simultaneously surfacing those sentiment-rich, detailed stories for the narrative searchers.
That's a great way to put it.
So we have established the mechanisms of trust, right? The volume, the recency, and the depth of the narratives. But whose trust are we actually analyzing here? Knowing what patients want is useless if we don't know who is actually spending their time reading this data.
And the demographics of trust completely shatter the idea of a universal one-size-fits-all marketing approach. The reliance on reviews is definitely not a uniform block across the population.
Here's where it gets really interesting. Let's break down the age brackets first, because there is a very distinct peak.
Yeah, the data shows that while reliance on online reviews is high across the board, it remains above 69% for every single age cohort. It spikes dramatically to roughly 86% for mature adults in the 45 to 60 age range.
86%. Why is that specific group acting as the ultimate power users of healthcare reviews?
Well, if you map that age range onto the typical human health lifespan, the spike makes perfect sense. The 45 to 60 demographic is the exact window when chronic health conditions typically begin to emerge.
Oh, sure.
Or it's when patients transition from basic preventative care to managing much more complex multidisciplinary treatments.
So the vulnerability metric just skyrockets.
Precisely. A 30-year-old looking for a clinic to treat a mild sinus infection might just glance at a star rating and book the closest available slot.
Right, they just want the antibiotics.
Yeah. But a 55-year-old looking for an endocrinologist or cardiologist, they are facing a highly complex, potentially life-altering relationship. They require a significantly higher volume of reassurance to mitigate their uncertainty.
Which drives that 86% deep dive engagement rate.
Exactly.
Compare that to the tech-savvy early midlife adults, the 30 to 44 group, who sit around 80%. They are heavily engaged, but they likely blend review sites with rapid social media vetting, you know?
Right. And then the 60-plus crowd surprisingly relies on them the least, dropping to about 68%.
Which is still a lot, but lower. Why the drop?
That older cohort often has long-established medical networks. They lean heavily on traditional in-network referrals from their existing primary care doctors rather than crowdsourcing their decisions online.
That makes total sense. The age data is compelling, but the income demographics are where the traditional playbook really falls apart for me.
Yeah, this part is fascinating.
The most active participants reading and leaving healthcare reviews are not the wealthiest patients with the most disposable income, nor are they the lowest income patients.
No, the engagement is intensely clustered right in the middle class. The study identified the highest participation rates in the $50,000 to $74,000 income bracket, closely followed by the $125,000 to $149,000 bracket.
So the middle to upper middle class.
Yeah. The extreme ends of the spectrum, those earning under $10,000 and those earning over $200,000, were stark outliers with much lower interaction rates.
Let's theorize about those extremes based on the behavioral data we've covered. I would guess the ultra-high earners, the over $200,000 group, aren't scouring the web because they have access to concierge medicine, right?
Right. Or highly exclusive private networks where trust is guaranteed by price and exclusivity. You don't need Yelp for a private concierge doctor.
Exactly. And conversely, the lowest income brackets often face severe systemic constraints. If you are relying on heavily restricted state insurance or specific community clinics, your choice of provider is already made for you by your network limitations.
Sadly, yes.
Yeah.
You aren't really shopping for a doctor. You are just trying to access whatever care is permitted.
So the core of this behavior is absolutely driven by the middle income brackets. These are patients who have enough insurance mobility to actually choose between multiple providers, but who still need to heavily vet those options to ensure they aren't wasting their deductibles on a terrible experience.
They are the economic engine of the standard healthcare market.
And geographically, the study points out that this behavior is heavily concentrated in the Pacific, South Atlantic, and Middle Atlantic regions.
Which means if a practice manager is allocating resources to build an online reputation, casting a generic national net is highly inefficient. The data dictates a localized strategy focused squarely on that 45 to 60 mid-income demographic.
Which brings us to the operational reality of this study. If I am a hospital administrator or a clinic director listening to this right now, I am officially terrified.
It is a lot to manage.
Right. The data says I need an immense volume of reviews to build Bayesian trust. Those reviews must be constantly refreshed to prove my clinic is good today. I need to maintain a realistic 4.0 to 4.5 average, and I need hundreds of long-form written narratives to satisfy the female demographic making complex health decisions.
It's definitely not as simple as it used to be.
You cannot just ask the receptionist to hand out comment cards as people leave anymore. How does a practice actually operationalize this behavior?
Well, the study's primary recommendation centers on capturing the sentiment at the exact right moment. We discussed earlier that 80% of patients have fresh experiences from the last 3 months.
Right.
So providers must utilize automated review triggers within a highly specific 24 to 72-hour window post-visit.
Why does the window close at 72 hours? It seems so specific.
Because human memory, and specifically the emotional resonance of an experience, degrades rapidly. Within that 72-hour window, the relief of a good diagnosis, the gratitude for a compassionate nurse, or even just the specific details of a clean facility are still visceral.
You're still feeling it.
Yes. The patient is primed to write the detailed narratives that other patients rely on. If you send a request a week later, the emotion is faded, and you will either get no response at all or just a generic star rating with no context.
This is exactly where the technology ecosystem has to step in, specifically solutions like RepuGen software. And a crucial point here, because we are dealing with patient visits, any automated system plugging into an electronic health record must be strictly HIPAA compliant.
Oh, absolutely.
You can't just use a standard retail email software to ask about a cardiology appointment?
No, HIPAA compliance is the absolute baseline. RepuGen integrates securely to automate that 24 to 72-hour trigger process without violating patient privacy. But the technology goes far beyond just sending automated texts.
Let's deduce how these specific tools solve the behavioral problems we just uncovered. Because I imagine a nightmare scenario for a practice is having an automated system that dumps 500 glowing reviews onto Google, but leaves their profile on WebMD or HealthGrades completely barren.
Which happens a lot, actually.
And a patient searching on a secondary site sees a ghost town, and that Bayesian trust we talked about completely evaporates. How does the technology prevent that lopsided reputation?
So the software utilizes a feature called the Review Balancer. It intelligently monitors the practice's digital footprint across the entire web. If it sees that Google is saturated but Vitals.com is empty, the software automatically routes the next batch of satisfied patient review requests directly to Vitals.
Oh, that's smart.
Yeah, it ensures that the massive crowd of authenticity is visible no matter which door the prospective patient walks through.
Then there is the narrative problem. If a practice successfully generates hundreds of detailed written stories every month, human administrators cannot possibly read and analyze all of them to figure out what is actually happening in their clinic.
It would take a whole team working around the clock. That is exactly where CommentWiz AI comes into play. It performs deep sentiment analysis on those sprawling narratives.
Right, because we know female patients are parsing these reviews for specific anxieties regarding wait times, bill-in transparency, and bedside manner.
Exactly. So CommentWiz AI reads the stories at scale and categorizes those exact sentiments. It allows a clinic director to instantly see a dashboard that says, your clinical outcomes are rated perfectly, but the AI detects a 40% spike in frustration regarding your front desk staff over the last 30 days.
Wow, so it turns unstructured emotional anecdotes into actionable operational data. And finally, patients want to know the clinic is actually listening to these stories. The text mentions ReplyWise AI. I assume this solves the bandwidth issue of trying to write personalized, HIPAA-compliant responses to hundreds of people.
You got it. Responding to reviews, even the negative ones, proves to prospective patients that the clinic is staffed by empathetic humans who actually care about the patient experience post-discharge.
Right, it shows you're not just a faceless corporation.
ReplyWise AI generates safe, compliant responses instantly, which closes the feedback loop and solidifies the practice's reputation as a responsive, patient-centric organization.
It is remarkable how the technology maps perfectly onto the psychological gaps the study identified. You need volume everywhere, review balancer. You need to understand the complex narratives, CommentWiz AI. You need to prove you are listening, ReplyWise AI.
It transforms raw behavioral insights into a systematic operational advantage.
So, to bring all of this together for you listening, the ultimate takeaway from the RepuGen 2026 behavioral study is that patient choice is not driven by a single magic bullet metric. You cannot game the system by chasing a sterile 5.0 rating and expect your waiting rooms to overflow.
No, patient trust is a complex, balanced ecosystem. They require the sheer quantity of reviews to prove you are a legitimate entity. They look for the realistic quality of a 4.5 average to prove you are a human organization.
They demand freshness to ensure you are consistently competent right now.
And they crave the authenticity of deep, written narratives to provide the emotional context for their specific vulnerabilities.
It really requires a holistic, technology-driven approach to digital reputation management. But, analyzing all of this data does leave us with a fascinating thread to pull on for the future. We have established how essential those long-form written narratives are for patients trying to build context, but the technology is shifting under our feet.
It is. This raises an important question for the end of this decade. RepuGen already utilizes AI to help practices analyze sentiment, as we talked about. But consumer-facing platforms are now rolling out AI review summaries that instantly distill thousands of patient narratives into 3 or 4 objective bullet points at the top of the screen.
Right. So if the AI tells you patients generally love the doctors but find the waiting room cold and the billing confusing, do you even scroll down to read the stories anymore?
Will prospective patients completely abandon the deeply personal human ritual of reading individual narratives? Or will we simply transfer our Bayesian trust away from the crowd and directly into the AI consensus of those voices?
That is a brilliant and slightly unsettling thought to ponder the next time you find yourself endlessly scrolling through reviews trying to find a new dentist. Thank you so much for joining us for this deep dive into the data. We will catch you next time.
Thanks for listening to the RepuGen podcast, your path to better healthcare.